Kia ora koutou katoa. Our plan to vaccinate New Zealanders is on track. Today, I want to highlight some of the progress in the COVID-19 vaccine rollout, and then the Director-General of Health will provide a general update on cases in New Zealand and on the outbreaks in Taiwan and Victoria. But first, I want to acknowledge the outstanding efforts of our healthcare workers delivering what is the largest medical event in our country's history. In my previous life, I worked alongside those currently running the program, and I see the large number of my former colleagues who volunteered to train as vaccinators and the many more who are volunteering to step forward. I know this massive effort is coming after we worked so hard to transform health services during lockdowns and subsequent outbreaks. And I know each of us feel a tremendous burden to serve our country in this program. I'm immensely proud of what healthcare workers are doing for all of us. This includes, as of midnight last night, 668,115 doses of the Pfizer vaccine have been administered. That's an increase of more than 104,000 doses on this time last week, and the biggest week of vaccinations so far. Friday was our biggest day of vaccinations to date, with 20,015 vaccination doses administered. Within that, more than 235,600 people have now received their second dose, which means they're fully vaccinated. We estimate about 50% of New Zealanders who have been vaccinated are fully vaccinated, a figure that compares very favourably internationally. Just yesterday, we administered more than 19,000 doses nationally, and overall we continue to track about 9% ahead of plan. These numbers are going up on the Ministry of Health website. We're adding to our stocks of Pfizer vaccine. A further delivery yesterday means we've received 971,100 doses so far, enough to fully vaccinate more than 485,500 people. And importantly, we've now received the approvals that this vaccine can be stored at normal fridge temperatures for up to 31 days. That increases our options for transporting it to remote communities, and it will make it easier down the track for people to have their vaccination in pharmacies or general practice. Each of our 20 DHBs are tailoring their vaccine rollouts to the needs of their communities. This week, Southern DHB launched its campaign to vaccinate the more than 32,000 strong Māori and Pacifica communities across Southland and Otago. The first of 6 roadshows kicked off last night in Oamaru, offering people the chance to kōrero with local experts and book whānau to be vaccinated together. Yesterday, the Wellington region's first marae-based vaccination centre formally opened. Wainuia Mata Marae Trust has provided a site to Hutt Valley and Capital and Coast DHB for the rest of the year, and I want to personally thank them for this generous gift to the vaccination campaign to help protect local korua, kuia and the wider population. On Monday, South Canterbury DHB started its first rural outreach for Group 3, offering vaccinations at Waimate Rugby Club. A mobile team of vaccinators will spend more than a week in the rural township. They've already vaccinated more than 400 people. The DHB is also running a clinic in Timaru for Group 3, and work there has carried on despite the flooding and the state of emergency. Now, I know there's a lot of interest in whether DHBs are meeting rollout targets. I want to congratulate Northland DHB, which has nearly broken even on its start target for this stage of the rollout. As of Sunday, it had delivered 26,597 doses. 11.5% of Northland's enrolled population aged 16 and over have received at least one dose. I heard firsthand about these fantastic efforts when I was in Northland last week, where I visited Ngātai Ora, the public health unit in Whangarei, and I also met with Ngāta Hine, who had just opened a vaccination centre to boost local services. I'll now hand you over to Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Today, there are no new cases of COVID-19 to report in the community, and we're reporting 6 in managed isolation facilities. The details of those cases and our usual numbers around laboratory testing and app use will be available on the Ministry of Health's website and media release. It's hugely encouraging that our vaccine rollout continues to track ahead of schedule, as the Minister has outlined. And a particular shout out to staff in South Canterbury, already mentioned, and their staff in Waikato, who have been able to continue to deliver the program despite the various challenges in those 2 locations. And I also just want to acknowledge the staff in Waikato who have been working extremely hard over the last 2 weeks to continue to deliver care to a wide range of people, and also the work that colleagues are doing right across the health system to support Waikato. I spoke with the Chief Executive there this morning. They're continuing to work hard to address the issues, and he is giving an update at 1:30 today. We can see how important it is that everyone is vaccinated when the opportunity arises, and our plans are in place to vaccinate everyone who is eligible in New Zealand by the end of the year. We can't for a minute afford to think that our work on the virus is done. We have seen overseas that it can creep up very quickly again. This has resulted in challenging outbreaks, sending whole cities or regions into lockdowns as communities grapple to control the spread of this virus. We know the number of daily new COVID cases in Taiwan continues to grow, and restrictions remain in place for at least the next fortnight there. Regarding the current Victorian outbreak, the likely window of infection of the index case there, which happened in a managed isolation facility in South Australia, has been reported as being merely 18 seconds when a person unknowingly infectious opened their door, and then this case, the index case, opened their own hotel room door within a very short space of time of each other while there was still potentially live virus in the air. That's no fault of anyone. It just shows, as we have said repeatedly, this is a tricky virus. There is great uncertainty with it. It is unpredictable, and the efforts that people are going to here to keep New Zealand safe are significant. The cluster in Victoria is now 60 cases, and we know there's a lockdown in place. We will be watching very carefully to see what the Victorian authorities decide over the next 24 hours around whether that lockdown is extended, and we will be providing updated advice tomorrow to ministers about the current pause on travel from Victoria. Here in New Zealand, we still have New Zealanders returning from overseas from COVID hotspots and regularly detect cases in our managed isolation facilities, as we've just reported. Our frontline MOQ workforce take the strictest precautions to keep themselves, their families and our communities safe, and they do that every day. With our own border incursions, we have reviewed and improved our processes in MIQ, but of course no system is perfect, so we remain highly vigilant and constantly learning and constantly looking to see what others are doing overseas, particularly as these new variants emerge. What I really want to say is that everyone in New Zealand still needs to keep their guard up. We cannot take our current situation for granted, and there are things we all need to do to keep the virus out. It's coming up to winter, so you may get a cough or indeed something you might think is just a cold. Please call Healthline and get advice on getting a test. You may have muscle aches. We know this is a less typical symptom of some of the newer variants. Call Healthline and get advice. Depending on your situation, you may be recommended to get a test. Likewise, with a headache or sore throat, or even sometimes gastrointestinal symptoms. It's super unlikely that your symptoms will be due to COVID until it isn't. The best way to keep New Zealand safe into the future is to make sure everyone who can gets vaccinated. And the best way to ensure everyone who is eligible can be vaccinated before the end of the year, which is what we are planning to do, is to keep the virus out. To do that, we need everyone to continue playing their part. And that includes continuing to scan assiduously the QR codes and to keep being vigilant for symptoms. Just on the current outbreak in Melbourne, we remain in very close contact with our counterparts there. We will be reviewing the pause on QFT tomorrow. One thing that we have seen in the current outbreak is the re-emergence of COVID-19 in staff in aged care facilities in Melbourne. We know from last year how devastating this virus can be if it does get into those settings. Our guidance at higher alert levels, that's levels 3 and 4, is that staff would not work across facilities if there is community spread. This is not part of our current guidance to aged residential care under alert level 1, as we have no community transmission in New Zealand, but we always keep an eye on what is happening and emerging overseas and constantly reviewing our protocols. In terms of the vaccination rollout, there is agreed advice with the College of Midwives and the Royal New Zealand College of Obstetricians and Gynecologists on COVID vaccination in pregnancy, coming out in around a week. Updated advice around vaccination with the Pfizer vaccine during pregnancy. We are currently also consulting with key health professionals who provide care to pregnant women to ensure that the approach that is agreed at a national level is fit for purpose for them. Minister, that's all I've got to say. So,
All right, well, with that, thank you very much, and we'll take your questions.
Yes, Saturday is the deadline by which you said that all MIQ workers would be fully vaccinated with both doses. Is that still on track to happen?
Yeah, they're required to show proof of vaccination on entry from Saturday.
Okay, obviously, so what do we know what the proportion is, or it just doesn't matter? They won't get in without showing both.
We do. I believe it's very close to 95% that is currently fully vaccinated.
Minister, looking at this advice that's coming through tomorrow from the Ministry of Health on Melbourne, I mean, the writing's pretty much on the wall, isn't it? We're going to extend the travel pause pretty likely.
Look, we always make sure we have the most up-to-date advice when we make this decision, that we're looking at the decisions, as the Director-General mentioned, the decisions that's taken in Melbourne, because of course, in Victoria, because of course that will influence us as well. So no decisions have been taken at this stage, and we're waiting to tomorrow to have that information and make that decision, yes.
Just quickly, if Melbourne does extend its lockdown, then there's effectively no way that we wouldn't extend a pause, is there?
We'll take that decision when we come to it.
On that, what measures are in place should the lockdown be extended? Are we looking into repatriation flights or support for people over in Melbourne who might be having issues with accommodation?
Yeah. Our message from the very beginning of the Trans-Tasman bubble has been flyer beware, and that New Zealanders travelling to Australia need to understand that they may need to shelter in place for some time. And I think at this stage, if there's anyone experiencing hardship, they should alert us through the Safe Travel website that contacts MFAT.
So on both of your views on the impact the lockdown has been having in Melbourne, because you talked about what your concerns at the beginning of the Melbourne outbreak with that link. What are you thinking now with the lockdown? Do you think it's had an impact on suppressing the spread?
Well, there's a total of 60 cases in the cluster at the moment. My understanding is even in the most recent cases, the vast majority of those, the ones reported today, are already able to be linked to epidemiologically to the existing cases, and they're confident they will find a link with the other ones. So what I would say is they're doing everything we would expect of them and everything we would do here. And the nature of this variant of the virus too seems to be suggesting it's more transmissible, and I know that the latest reports say that even quite fleeting interaction between people, admittedly in a closed space, which we know is a higher risk setting, has seen people infected. So we'll just keep a close eye on it, and also especially as they start to get through the outbreak, try and draw out the lessons for what that might mean for our response here.
When those Kiwis who are affected over in Melbourne return to New Zealand, what will that look like? Will they pose a risk to New Zealand's community? What will we see? Will we see restrictions on those people for the likes of 14 days? What can those Kiwis expect when they return home back from Victoria?
We'll have to make a risk assessment at that time, which takes into account their risk of exposure and the period of quarantine is one way in which we might manage that risk. I don't know if you have any other comments to make, Dr. Bloomfield.
We're looking specifically if we get into a situation where people are coming back while there's still a lockdown situation for whatever reason, what the options might be for their travel back, including the role of pre-departure testing when they arrive, and also the duration of a period of isolation, and whether that needs to be in managed isolation or whether it could be at home.
You outlined before that the transmission between the index case and I guess the second case was only just 18 seconds, and that was between both of them opening their doors. How concerning is it that the transmission is such a quick turnaround?
To be honest, the main thing that reflects is that it's airborne transmission, which has been an emerging thread of evidence for some time, because over the last, say, 6 months or more, and that's what that shows, that it isn't necessarily direct contact, because direct contact, droplet spread when you're proximate to each other is related to the period of time. It's more likely to reflect airborne transmission. And we've seen that, and I guess the question is whether some variants are more predisposed to that, and that remains an area of scientific inquiry. Yes.
To vaccinations, is there an update on what involvement GPs will have in the vaccine rollout?
Well, we're eager to see primary care be able to vaccinate people, particularly because many people will have an established relationship with their general practitioner or practice nurse and trust them. But Dr. Bloomfield, do you want to go through the specifics of that?
Just 2 comments. As we scale up through July and August from around 80 sites to 800 sites, many of those additional sites will be general practices or pharmacies, and we're imagining somewhere between 30 and 40% of general practices during that initial scale up. The change in the ability to store the vaccine at 2 to 8 degrees for 31 days really does transform our ability to bring on more and more general practices. And this is particularly helpful because as we get towards the end of the year and we move into a more business as usual with the sort of, you might say, the mop-up of people who are either becoming newly eligible, entering the country, that will be largely through general practice and pharmacy. So we're anticipating general practice and pharmacy will play quite a significant role through the vaccination of groups 3 and 4.
How long is the computer system for booking vaccinations?
Well, it's looking really good. It's been trialled in 4 sites, and from this week it's starting to be rolled out incrementally to each district health board. Started yesterday with Taranaki, Wairarapa also this week, and then through the month it will be rolled out to each of the district health boards. And I should say that is this easy thing to say, but it involves a significant team of people going in and supporting. Of course, people need to be trained in the use of it at that DHB end. What I can say is, and we've done a number of demonstrations of this, including to cabinet ministers just yesterday. It's a very user-friendly and I think a very good sort of interface for people, and also the fact that it's cloud-based means that it's got very high capacity for people to be able to book in, and also early on, even when people, for example, those in Group 4, like myself, who are not yet in sequence to be vaccinated, will be able to indicate their interest in being contacted. So people will be able to register even if it's not yet their turn to be vaccinated.
Do you have an update on the available stock that we have?
Yes, we do, and the Director General is just looking it up. I'll take another question while he does that, yes.
No, pass. This is for Dr. Ashley Bloomfield.
Well, I was actually just going to ask about the sequencing there for Group 4. Can you explain how exactly that's going to work out? Is it going to be broken up by cohorts of age like we've seen overseas? Is it going to be based off of people putting up their hands and showing interest? Or is it just going to be on July 31st, the portal will be open and everyone in New Zealand, 2.5 million people can put their hands up?
Well, it won't be that one, will it? So the plan for the rollout in Group 4 is being worked through, and exactly how we should put some more structure around that and what factors we should consider. So we're working through that, and we'll be able to make further announcements on that in due course. Do you have a response on that?
Just vaccine stocks, 260,000 doses in, and we're expecting again next week a further 49,000 or so doses to arrive. What I would also say is that in addition to the online ability to register, there is also a whole team being stood up at Healthline, Whakarangarau, and so people will also be able to call and do the booking through the Healthline phone number as well. It will be a special phone number. We will be giving more information out over coming weeks around just the timing when people can expect that they are likely to be invited. But as I say, that doesn't preclude people from registering their interest first up, and then the more information and details we have of them about them, then we have the ability to link to their NHI number, and then it's all ready to go for when that time comes.
This updated vaccine
colleague over
data.
here has been waiting for some time.
Dr. Ashley Bloomfield, have you sought assurance that the Olympics is safe to go ahead?
I wouldn't see that as my role to do. That'll be a decision for the International Olympic Committee in discussion with the Japanese authorities.
Go ahead, given experts including Michael Baker says it shouldn't?
That's a decision for the International Olympic Committee.
The available stocks that we have, does it look like we're basically going to run through them at the end of the month So if there is no arrival, and when will we find out from Pfizer when the July shipments will be and what they will be?
So we're carefully calibrating the delivery of the vaccine, and there was a story around this morning about showing that some of our vaccine sites have more capacity to deliver, which is good. They are gearing up for when the new large volumes of doses do come through. We are carefully calibrating the rollout to our supply at the moment. We are expecting to find out in the next few days from Pfizer what the schedules of delivery are likely to be through July. But in the meantime, I think you would have seen statements from Pfizer a couple of times in the last week confirming their commitment and no barriers to delivering, as they have indicated that they would. We're just waiting for the detailed numbers for July, and we're expecting those in the next few days.
We're roughly 100,000 a week happening at the moment, and if we're getting 50,000 a week up to the end of the month, then we're basically, less than 100,000 if nothing else comes. What's the plan B if there's a delay?
Well, let's see what information we get from Pfizer in the next few days, but I was asked that a year ago. The plan is the plan. We'll wait and see what Pfizer says, but we're running it to, as the Minister said, it's 109% of what was planned, so we're running it very much to the wire, but we are also very confident. Pfizer has not let us down at all to date, and we're confident that they will deliver as they've said they would.
AstraZeneca MedSafe approval, is that far off? And can that be rolled out if Pfizer doesn't arrive?
Actually, the approval of the Janssen vaccine is closer, and the committee that is considering that is meeting on the 15th, and so we're expecting advice from them in the day or two after that, so we'll let you know when that advice comes through. We are still waiting for further information on AstraZeneca for the MedSafe to be able to do the full assessment.
Do we have shipments of Janssen that have arrived?
No, they had never. They had always said that they would start to arrive in the third quarter, but we can't do the final. They can't give us the final dates for that until it's been approved.
The Pfizer data on the 12th to 15th was expected to be in with MedSafe at the end of May. Has that happened?
Yes, they have got the data and they're analysing that at the moment, so we will give an update on when we would expect a decision to be made about extending to that age group, if MedSafe says it's appropriate to do so.
Just in the new vaccination data, how many of those shots have been delivered to Group 3? Do we know that?
Over 75,000.
In terms of, have you had any new or updated evidence in terms of what level of vaccination we need to get out to achieve something like herd immunity? Overseas, with the new variants of concern, there's been some jurisdictions where that number has been put as high as 90%. Is that something that you've been looking at here?
Yeah, certainly we have a number of expert groups advising us, and some of them are looking at precisely that issue. It's a very complex area. I think we've traversed some of the complexities before. Firstly, that whatever coverage target you have to try and reach, the unvaccinated people who are too young to be vaccinated, of course, won't be, so that means you have to be even higher in your vaccinated population than you might estimate. Yes, indeed, there is questions that if a new variant is shown to be more infectious, so to have a higher R value, that also might raise your threshold for achieving population immunity. But I think also in some of the conversations we're having, we're going into the complexity of precisely what herd immunity means, and understanding that it doesn't mean absolutely no cases, that you do get cases from time to time, but the ability for them to extend into a large outbreak is really reduced when you have high vaccine coverage. And then there are a number of steps before that threshold is reached where the public health impacts of COVID might be anticipated to be less. So those are the sorts of things that are being worked through, but early days.
Target, though, would you see that as sort of the end point for at least this first phase of the vaccination program, whether we hit 70 or 80 or 90% of the population, adult population?
Yeah, so to make that sort of decision, we really need a lot more information. We are working very hard on it, but we're not there yet. Yeah, Aaron.
Is there any scenario where Melbourne extends the lockdown, but we think it's safe enough to start bringing Kiwis back to New Zealand?
Well, at the moment, we're waiting to see if they do decide to extend, and at the same time, we'll be looking at our advice around the current travel pause. And let's see, that will be tomorrow, and I'll leave it to ministers once they've made a decision to make public what the decision is.
A health perspective, like, could Melbourne ever, if they're in lockdown, would it be health-wise safe for Kiwis to start coming back, or do they need to come out of lockdown for then us to start that process in sort of any way, shape or form?
What, as I said earlier on, what we're doing is considering about if there were reasons why people needed to come back for urgent reasons, and Melbourne was still in a lockdown situation, we're looking at what might be the public health measures we would have in place to make sure we were achieving our primary aim, that is to keep the virus out of New Zealand. And so all these are things that we will provide in our advice to ministers tomorrow.
At the back.
Associate Minister, you mentioned before that most DHBs are either ahead of their vaccination targets or catching up, but
That's what an average is, yeah.
oh yeah, sure. The latest data shows, I think Auckland is about, well, last week was about 93%, and I've slipped to 91% this week. Are you concerned at what's happening there, and do you have any insights into why they're slipping?
I don't know, maybe the Director General would want to add something about the Auckland situation, but indeed the Ministry works really closely with every DHB on how it's tracking, and as I discussed in Northland, where there have been issues, we work closely to make sure that things can be lifted up, and we're really pleased to see success in that area.
Yeah, thanks, Mr. Just to say that the northern DHBs, Northern Region DHBs, so Metro Auckland plus Northland, is still about 40% of our total vaccinations that are being done at the moment. So if you think about their contribution to the country's total, it's actually ahead of what it would have been, even if they are a little behind the plan that they had set for themselves. I don't have any concerns about that, and I know that they are continuing to roll out, for example, roll out additional general practice hubs. They already have, I think, around a dozen in place, and there are further ones coming online. So they're continuing to build capacity there too.
Just to follow up on Derek's question for Dr. Bloomfield, if for any reason the Pfizer, the big lots of the Pfizer vaccine are delayed, the program here will either slow significantly or stop, basically. Is that correct?
Yes, and you've heard Minister Hipkins talk about this before, that we are intending to use the vaccine we have got in anticipation that more will come. If there is a situation where we need to slow things down for a week or two, we will do that. However, we are also at this point confident that Pfizer will deliver, and there's no reason to believe they won't.
Just on the WHO giving the different strains of COVID variants new names, is this a helpful contribution, or does this make the whole thing a bit more confusing?
In my experience, virologists do this all the time, make them rename as new conventions emerge. It does mean that if you're in touch with the scientific literature, you have to be watching the changes in names all the time. I think one of the important things that, in terms of the public, is that one of the things the WHO is trying to get away from is naming variants after the origin of the place they were first detected, because that is quite stigmatising, and it's no guarantee that it did in fact evolve there.
So we'd be talking about the Gamma variant as opposed to the Indian variant?
Correct, yeah.
How quickly we could get the Janssen virus here with MedSafe approval?
I'm assuming you mean the Janssen vaccine rather than the virus, and this is a new variant. I don't know what that would be called, Epsilon maybe. Look, Janssen have always said that from July, from that third quarter, is when they're planning to be able to supply it. We'll go through the approval process, and then we will have a better idea, and we'll be talking with them and get some firm dates around delivery. We are intending to proceed with getting that vaccine on shore, should it be approved by MedSafe, and our scientific advisors suggest that it's give advice to ministers who ultimately make the decision to use it, because we do feel that it is appropriate for us to have and this is one of the reasons why we had a broad portfolio. We think it's appropriate to have a second vaccine to be able to help us deal with contingencies. The good thing about this vaccine too is it can be stored for up to 2 years at normal freezer temperature.
We have an idea of when the earliest that might arrive?
Not yet, but we will let you know when we do.
If we are successful in getting everybody willing and able to be vaccinated by the end of the year, is there any reason why we don't completely open the borders on 1st of January 2022, and would that be your advice as well to the government, and also to disband MIQ and just go back to normal, I guess?
Well, I think Minister Verrill's already spoken somewhat to this, but the only thing I would add is it depends. And the reason I'm saying that is it is quite clear that this pandemic is probably not even halfway through. We might be at the end of the beginning, but we can see that new variants emerging all the time. Countries that previously were keeping the virus out are now challenged by that. We can see outbreaks emerging in countries like India recently that are extremely extensive. Our strategic advantage as a country to date has been our agility, and it is very important that we maintain that agility. Vaccinating the population gives us more options, and I think the discussions that are being had right across government and with the business community as well are how do we make sure we exercise those options in a way that maintains our current protection of New Zealanders and without making any hasty decisions.
And so to that end, it won't feel like flicking a switch at the conclusion of the vaccination program. It will be a managed process.
On these vaccines, the current situation in some cases means people are calling 0800 vaccine numbers and finding the system has no record of them, so their details are being manually entered. This seems far from ideal, do you not think?
So what I can say is that the booking system, and indeed whether that's done online by people or through ringing the healthline whakarongarau, that is designed to make sure that we have the up-to-date details of people and we are able to match it with their National Health Index number. The advantage then is that we can provide information out to their GP and we can record also when they have their first and their second vaccinations on our new COVID immunisation register. The current processes for booking and for vaccination vary across the country, but it's for most of them it does require people to provide that information, their personal details, and then that can be matched to the NHI database. That won't change, except the process will become much more consistent and easier across the country.
When calling these 0800 numbers, their details aren't even coming up. So what do you say?
Are these people who haven't had a vaccination yet, or people who have already been vaccinated? Haven't. Have been vaccinated. Well, I'd be very surprised, but if you can provide examples for me, I can follow those up.
Mark.
When Group 4 begins vaccinations, so just to clarify, what you're saying is not everybody in Group 4 will have a shot at being vaccinated from the start of the Group 4 rollout. There will be some form of sequencing, whether that's by age or region or something else. Is that correct?
Indeed, and you can see that from the profile of the model that after July the expected trajectory is, with some variations, roughly flat, isn't it? So obviously we cannot have a big surge of people all in one go from July.
In the House yesterday said that DHBs could access the National Immunisation Register to look at the vaccination status of each one of their employees, presumably even people who are not involved with the sort of COVID-19 response whatsoever. Is that a violation, of their privacy? And are there any other government agencies or departments that would be able to access the register to check on the vaccination status of their employees?
Yeah, so just remembering that district health boards routinely deal with occupational health and safety issues for their staff, including having to maintain databases of whether or not their people are vaccinated for hepatitis B and other viruses that they are at risk of the healthcare setting. So I'm sure there is a privacy part to work through with that, but that's a pretty normal process in a health employer.
You said before that 95% of MIQ workers were fully vaccinated. Do you have a number for non-MIQ border workers?
We'll be able to give that to you, yes.
What is that based on?
It's based on, if I may, it's based on the data in the border worker testing register, and what I can say is we can try and get the current figure, but it is growing all the time. So we're continuing to see uptake of vaccination by our border worker border workforce across a whole range of settings and across the more than 500 employers in border settings.
Looking to be able to match the testing data of those border workers with the immunisation register. Has that happened?
Yes, so employers are able to go in and check on the vaccination status of their employees if those employees have given permission. In fact, they can do that now to determine whether someone is or isn't vaccinated.
We also go in and see that everyone who is being regularly tested according to the register is also vaccinated.
That's correct, yes. We're able to do that for the different groups working at the border, yes.
Are you aware of any sort of the proportion of those who are being vaccinated, who are being tested regularly, are in fact also vaccinated?
I don't have the proportions with me, but we can find out that information.
Back to the Melbourne situation for a moment. There are 500 rooms in MIQ that are left vacant for the Trans-Tasman bubble since it opened about 2 months ago. So we've got about 2,000 spots of MIQ room left open just in case something happens with the bubble. We now have the situation in Melbourne. We're looking at the possibility of a fortnight's worth of lockdown. Where's the threshold for when you start using those rooms? And is there a possibility that those rooms could be used for a less than a 14-day stay?
Yeah, so as I mentioned earlier, should we ever approach a decision like that, we need to do a full risk assessment, and it may well be that in a particular permutation in Melbourne, by the time we are able to do that, the risk will be lower in returning New Zealanders from Victoria than it is in other parts of the world, and we may well be able to work through a different quarantine requirement for that. But it just depends on the facts at the time that we are able to do that. Unless you have any other comments on that, Dr. Bloomfield?
Just to reiterate the comment I made earlier on, we are looking at, given the situation in Victoria, if people are coming back, and that's a decision yet to be made under what circumstances and when, what the requirements would be on them. And yes, as you've suggested, one option is that they may not be required to stay in managed isolation if that's what's decided for the full 14-day period based on a risk assessment, but we're looking at all the options and that'll be part of our advice.
Right, I'm due in the House very soon, so one last question.
I just wanted to ask about that, matching with the register and the testing register and the immunisation. Every time I ask the Ministry of Health about that, they say, well, we only look at the MIQ. The broader border workforce we don't have eyes on. So who has eyes on that, and who would I ask about that?
Someone important will have eyes on it. I will find out who, and I will find out what they are seeing.
MB does. Good. Thank you very much.